Now it's me. Let's rise for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Greetings, everyone. Thanks for coming to the Health and Human Services meeting of July 1st. You have an agenda in front of you. Hey, right, we're moving. Got it? All in favor, please say aye.
Aye.
Any opposed? Your minutes from June 3rd. All right. Any further discussion? All in favor, please say aye. Any opposed? First time for limited public comment. If anyone would like to address the board, come on up. Nope, everybody's sitting tight. All right. There will be another chance at the end. That brings us to Barry Eaton Health Department. Hello, good morning.
Good morning. My name is Miley. I'm the Planning and Promotion Director for the Health Department, and I'm going to give you an overview of our semi-annual update. So we'll start with our Environmental Health Division. It's the summertime, and every summer we do mosquito surveillance, and so that has kicked off. We have an intern here. They are here twice a week in both counties, and they're helping to collect mosquitoes, and they look at them under the microscope and look to see if they've got, we do some testing, send them in for testing to do, see if they have West Nile or other vector-borne diseases that are popping up in Michigan. So that has just kicked off now that the warm weather has started. So this, like I said, happens every year. I think so far we haven't had any that have tested positive for anything, so we're looking good there. The second thing that environmental health is working through recently is our EH software update. It's called Hedgerow, and it's been a big lift. It's been several months that we've been going through this transition. It'll really help modernize our systems and our data. We will have a public-facing dashboard or interface that will make it more accessible for the public to get their records or see some of their property information. So we're looking forward to that. The public-facing portion is probably about maybe a month out still. So internally, we've implemented it. We're working through some bugs. And then the public-facing portion will be available probably next month. So we'll be sure to update everybody on that when that comes. Moving on to the next thing. So we just finished up the community survey process for our community health needs assessment, which is also called Healthy Capital Counties. We partner with Clinton and Ingham to do a tri-county needs assessment. We have to do a needs assessment every 3 years. We partner with our local hospital system, so hospital systems in the tri-county area, to conduct this because they also have to do a needs assessment for their accreditation purposes. So we have just started the CHNA process, and that first kind of piece of that was that community survey. So now we've got the community survey information back. We're analyzing those results, and then we will be working to publish a needs assessment report here in the next couple of months. The step after that will be after the needs assessment comes out, we'll put out a community health improvement plan. And so that is where we get the community together and the stakeholders, and we talk about what we need to do to address what we found in the needs assessment. So our biggest priorities and barriers in the needs assessment. We recently had a medical marijuana lockbox giveaway. So as you may know, we are the recipient of the medical marijuana oversight grant for the county. And so the county gives us the money to do some programming around that. So we recently had a drive-through event where people could come on Saturday. It was, I think, June 26th, 27th or 22nd. We were there for about 3 hours. We gave out 35 lock boxes, And with that, we also were giving out some harm reduction supplies. So we gave out some Narcan and some drug disposal bags for individuals to take home. The lock boxes were free to anybody who lived in Eaton County. And we have some left over, so we're planning on doing another event here in July, and that will probably be during the week after work hours. And then they're also available at our Charlotte office for anyone who wants to come in and get them. There are a couple of businesses around the area that we've printed out coupons essentially, so you can take a coupon from their desk and then come redeem that at the office for a lockbox. And then we're also partnering with one of the new dispensaries in Charlotte, and we're hoping that they'll either be able to have lockboxes on hand at their location, or they'll have the coupons for individuals to take to our office. Moving on to an update for our overdose data to action grant. So this is the grant that we received in September of 2024. So we're still in the first year, or I'm sorry, 2023. We're in the first year of that still. We've been able to accomplish quite a few things so far. And what I would say is probably the most notable are the increased access points for harm reduction supplies. So there was recently a vending machine placed at the Delta Township Library that has harm reduction supplies in it. We're working with Eaton County Jail to have one delivered as well. Siren Shelter has supplies, but they are also interested in a vending machine. And then we've been able to deliver supplies and provide supplies to lots of different organizations. So even though they may not have a vending machine or another type of distribution box, they do have supplies on hand. Then we were able to also recently hire, CMH was able to hire a peer recovery coach. We provided them with funding to be able to do so. They were hired in May of 2024, and they are here to serve Eaton County only. So many of the peer recovery coaches with CMH CEI function as a tri-county peer recovery coach. And so this peer recovery coach is dedicated just to Eaton County. And then we've also been able to expand our Connections program, which is our community health workers program, to address clients that have substance use disorder. And we were able to hire an additional community health worker in February of this year to help with that expanded caseload. And then we're working with community organizations to work on referral processes and educating them on the services that we can help provide. And we're partnering very closely with CMH and that peer recovery coach to be able to make sure that anybody that comes into the Connections program that may need the services of a peer recovery coach can easily access that. And then I will talk a little bit about some upcoming events that we have going on. So in August, it is Breastfeeding Awareness Month, and so we are doing a breastfeeding awareness event at Alive on August 7th. There will be local vendors there, information for how businesses can become more breastfeeding friendly. It's really geared towards families and moms either currently breastfeeding or looking to breastfeed, to support them and have resources available and be able to kind of talk to area organizations about what they may be able to assist them with. And so that will be from 9 a.m. to 12 at Alive on the 7th.
Miley, could you talk to the committee about the cafe and when it
Oh, yeah.
meets? Because that's a kind of a cool program, and I'm not sure that the members are aware of it.
Yeah, so we have the Baby Cafe, which is an informal breastfeeding support group. There's a lactation consultant on site every cafe meeting, or every meeting. They meet on on Tuesdays. Wait, I'm getting my counties mixed up. On Wednesdays from 10 to noon at Alive. And so our staff, so some of our nurses may be there, our WIC staff, and it's just really a place where moms can drop in. Again, they don't have to be currently breastfeeding. They can be thinking about breastfeeding. They can be pregnant. Support systems can come. So mom, dad, grandma can come, and siblings are welcome as well. And it's just a place where they can seek support from other moms, but also get advice and receive some consultation for lactation support if they need it. So yeah.
It's kind of like a mother's networking group. And, you know, we all have groups that we're involved in that are networking and friends and family. And it, you know, this is a group of specialized moms that all are kind of going through the same place in life, and it's a good opportunity for them to meet. And Health Department makes that available for them, and it's actually quite successful. A lot of moms seem to gravitate toward it, and it becomes sort of their Wednesday morning get together, coffee clutch, wine and complaint session.
Put the moms together. We don't want to talk tools.
I think you might be invited to the group, Blake.
I think we kicked off in July of last year, so we're almost coming up on 1 year, so that's exciting. But yeah, it's been a good adventure, and we're hoping to be able to keep it going.
I have a question. I see where it says fairs, 4-H, it said there won't be no lactating cows at the permitted, this needs to be 60-plus days, so there won't be any, there'll just be young stock there then.
Yeah, so that's actually my next update for the bird flu or the highly pathogenic avian influenza. Yes, so MDARD released orders that said that you cannot show lactating cows unless there have been no cases of HPAI in lactating cows for 60 days. And so fairs have been informed of this, and we're working with them as well. Our emergency preparedness coordinator is working with the 4-H clubs in the counties and the fair coordinators to make sure that they're aware of this. But yes, that is correct. To give you a little bit more of an update on that, there were, as many of you may know, 2 human cases reported in Michigan. Neither one of those were in our counties. There's been 8 total facilities for poultry. That's 1 backyard flock and 7 commercial. There have been no new detections in poultry flocks since May 9th. There's been 25 cattle herds. The last detection for a cattle herd was in June 7th, so we're still within that 60-day window. And then there have been 2 household cats that have been positive for HPAI. We've been working with farmers and dairy establishments in the area to provide PPE. So the state has a system where they can request masks, gloves, gowns, eye goggles, all that PPE protection from the state if they are interested, and the state will coordinate delivery of that. So we've had 1 farm in our jurisdiction that has requested PPE, and we were able to fulfill that. And then again, the MDARD orders, like you said, no dairy cows that have been lactating are permitted until there have been no new cases in 60 days. Poultry has also the same rule, however, that has been, we're at the 30 days for that because the last case in poultry was May 9th. However, if there's another case in poultry, then we'll see that go back into effect. So poultry will be allowed with precautions at the fairs, and then no dairy cows for the ones here in our counties since they're coming up in July. And that is all the updates I have. So does anybody have any additional questions?
Thank you, Mila, for your report today. I've got a few questions here. You talked about the mosquito research you do every spring, whatever. What is the position of the health department on people putting up bat houses to control mosquitoes?
Yeah, I don't know that we've gotten that question recently or before. I haven't had it. I don't know that we have an official.
You don't have a
position on it.
position?
Yeah,
Okay.
yeah, but I mean, I could see the benefit, absolutely.
When I moved into my neighborhood, there were a lot of bats. Okay? And you saw them every night for the streetlights, diving in and out and whatever. And that was 25 years ago. We haven't seen very many bats recently. I heard that they have been under attack for many other reasons, you know, environmental reasons, whatever. But I just wanted to know, because it freaks some people out that I have a bat house. I'm trying to attract bats, but it's for mosquito control.
Sure.
Okay, so I would just like to know what the health department has to say about that. Okay, and the Narcan. Okay, it was recently revealed that the sheriff's department has a stronger drug that's very hopeful about controlling overdoses. You didn't mention anything about that in your report. Any follow-up on that?
Yeah, so that, we're not partnered on that. So that is something the sheriff's office, from what I understand, is doing a pilot project with the company that offers that drug. What I will say from the public health perspective is that there are definitely concerns about the higher strength of it, especially with it causing withdrawals more quickly, and not really being more effective at preventing overdose just because it's the higher strength. So there's definitely some more information we can share around that, but we do have some concerns about using that, and there's been some research and some information put out by CDC recently that we can share that will support that. You know, now is not, what we know so far shows that the Narcan that is currently available over the counter is effective and is working, and that's what we should be using right now, so.
Yeah, I believe the sheriff mentioned that on some overdoses that they had to use multiple injections. I didn't realize with Narcan that there's a limited time frame. I thought once you gave it, that was it, you know. Well, proves out to be a little bit different than that.
Yeah, there's definitely some nuances there. It's not uncommon that they have to use more than one dose of Narcan, and so 2 doses sometimes works, sometimes it's more than. It just depends on the type of opioid the individual has encountered and the amount. But yeah, we definitely have some concerns about, I think it's called OPTV. So we'd be very interested to kind of hear how that pilot goes, and I think we're working with them to learn more about it, honestly. So we've recently heard as well that the sheriff's department is engaging in that pilot, and so we're looking to them to partner and kind of gather some more information and learn more about what that looks like for this county.
So you and we'll monitor that
Yeah,
situation.
yep,
Yeah.
yep.
Let's see. Drug disposal bags. Okay, we got some of those at the Tri-County Office on Aging. They distribute them. And I'm going to tell you what, they work wonderful. They're a great little product to keep on hand. Takes care of the overflow of drugs in the household. But we used to take all of our excess drugs to the recycling events, but they haven't done that a year or so, I would imagine. That and document shredding seems to have kind of gone away. Okay, the vending machine for the Narcan at the Delta Library, how does that work? How does a vending machine work?
Yeah, so they have it placed in their library inside. Anybody can access it. It's got Narcan, test strips, drug disposal bags, first aid kits, lots of other items in there. It's free for anyone to use, and so they have a stock of supplies that they can restock that vending machine with. It's their vending machine, and so they get to decide really what goes in it, with the caveat that it should be for harm reduction purposes. And so anybody can go into the library and anybody can utilize it.
You don't need ID or credit card, it says it's free, no
It's
credit
free,
card.
yep, it's free.
Okay, I'm gonna have to check that out. Okay, thank you very much.
Yeah, no problem.
I was in a conversation this weekend, just because some people have some expired drugs. My niece is a pharmacist, and she was telling this other person, well, you can drop them certain types, not Redwoods, whatever, off at Myers and different pharmacies. So that might have something to do with the drug recycling.
Yeah, so a lot of pharmacies, and like you said, Meyer, I know the Meyer by where I live is one that you can just go up into the pharmacy area, there's a little box, and you can just drop your pills in there. And so there are some other pharmacies, and I can't name them off the top of my head, but it's certainly worth looking into if you have some drugs that you want to get rid of, and you can just drop them off pretty easily. So you don't have to wait for that yearly event.
She gave like 3 main options, you know, I just remember Myers being one, but there's some larger places that you
Yep.
can just walk up and drop them.
Yeah.
Good.
Yeah, it's a really good solution.
I think I remember seeing one in the lobby at the Sparrow Eaton U of M hospital here in town.
The artist formerly known as Hayes Green.
Yeah,
Right.
that one.
We used to have one here for years, and I don't really know what happened to it or why it got phased out.
That was a program that was done by the sheriff's department, then they don't have it anymore. But I'm sure there's a box in the lobby at the hospital, though.
I know that when the pharmacies first started taking the drugs, it had to specifically be from that pharmacy.
Right.
Now, I think they've kind of opened it up to all stuff now, right?
Yep.
Correct? Yeah, okay, thank you.
Very good. Any other questions? All right. Are you tackling the
Yes.
master plan as
So
well?
I'm actually
Substance-
gonna invite my colleague Kaylin.
Strategic
and,
plan,
Amy is also here from Michigan Association of Counties, and they are really gonna be the main spokesperson. So
All right.
I'm gonna take a step back.
Okay. Good morning.
Morning. As Miley had mentioned, my name is Kaylin Meeson. I am a community health promotion specialist here at Berry Eaton District Health Department, and I have had a great opportunity to begin working on the strategic plan and really engaging with a lot of our community-based organizations and Eaton County entities. So this kind of all really started taking place with community engagement back in the month of December. We ended up holding 2 large stakeholder meetings to kind of get everything very well established in relation to the opioid settlement funds and the best way to spend out these dollars to really make a difference in our community. And so in our first strategic planning meeting, we ended up going over a lot of strengths and weaknesses, and we did this very large consensus workshop, making sure that everyone, whether it was just a resident in the community, whether it was a healthcare provider or, you know, a local like wellness center, everyone was on the same page and understanding where we were at with the opioid epidemic. And, you know, we all have different interactions and different experiences that we want to make sure that are at the table so that when we create this entire strategic plan, it's very well representative of where our community is at. And so with our strengths, weaknesses, we talked about some opportunities and some threats. And we were able to kind of go through and process that into our second strategic planning meeting where we really started talking and doing a deep dive into the assets that this community has. And again, we were very fortunate. This was an extremely interactive group. You know, we might have had to switch from in-person to virtual, and people were very engaged even through the online portion of it. And so we were able to identify assets or resources or services that are provided to and open to our Eaton County residents, whether it was inside of the county or outside of the jurisdiction. And that led into further discussion about identifying where our gaps are. You know, housing was something that came up, treatment centers came up, transportation came up. You know, Eaton County is a very rural county, and so a lot of these may seem like gaps for several different services that we have, but this is all something that we're able to work towards. So with that, we were able to do the assets, the needs, and then we really started diving into kind of these like pillars of addressing substance use. So that has to do with the aspect of prevention, harm reduction, treatment, and recovery. And everyone has their little niche and where they need to go or where their perspective or where their experience is going to best benefit the building of the strategic plan. So we ended up breaking into subcommittees back in March. So March, April, and May, we had all of our subcommittees meet based on the pillar of which they best associated with. And with that, we were able to begin building the goal of that pillar or how they were going to address substance use, whether it was specifically prevention, whether it was for harm reduction, treatment, or recovery. So they talked about the goal, they talked about some big strategies, some things that we wanted to address. And then in addition to that, we identified activities to go along with it to actually meet that expectation or meet that change. And in order to make sure that those activities would actually, meet the impact of like what the strategy we wanted to change was, we also came up with some metrics or some measurables that go along with it. And with that, we ended up meeting one last time back in June to kind of go over the entirety of the strategic plan and all of the pillars. So we talked about, increasing the awareness of substance use disorder and the early intervention options that go along with it in order to reduce the stigma around it. So then we also talked about increasing the access to and kind of the education and proper utilization of harm reduction supplies. We talk about how we've increased access, but we want to make sure that if you are getting Narcan, you know how to use it. If you are getting the medication disposal bags, you know how to use it appropriately and that kind of thing. And then we also talked a lot about decreasing access barriers to treatment and transportation, or decreasing barriers to like accessing providers and making sure that the availability of those resources are there in ways that we can do it. And then we also talked a lot about increasing sober recovery housing inside of Eaton County because a lot of our residents have to leave the jurisdiction. And lastly, the one big thing that was pretty universal between all of the groups was identifying the supports and education to family or loved ones in the area. That all being said, I do want to reiterate, this strategic plan was all developed based on the community and seeing what they needed, what organizations can do. And it's all about the community being able to utilize this and making sure that this is a community effort to actually address the substance use problem that we're having in Eaton County. And that being said, as you go through the packet, you can see that there are some universal themes that should be applied throughout, and then each of the pillars have all of those strategies underneath. So individuals are able to go in and look at this document and see, I'm in prevention, what can I do? How can I help address this issue? And with that, there's more going along with this so that we have all of the information and kind of like a baseline for Eaton County. And it has to do with the MSU Community Needs Assessment that we've also been conducting simultaneously with this and kind of cleaning up all of that information that goes along with it and the education of substance use disorder. But I did want to offer an opportunity for Amy to come up from Michigan Association of Counties and kind of go over some next steps that are with it.
Thanks. So Amy Delinky, Technical Advisor on the Opioid Settlement Funds with the Michigan Association of Counties. Just to give everyone an update, so as the Michigan State University community assessment has been going on, so surveys, focus groups, interviews, they've collected all of that data and are currently in the process of compiling their final report. And this strategic plan will be used as a qualitative source of data in that report. So that way we have kind of this community side, and then what report comes out will have recommendations on the greatest areas of need, both from the survey and the strategic plan, which then the county can use to really guide and influence spending for opioid settlement funds. So the date that we are expecting to see that report is September 1.
I would like to piggyback on, this was, first of all, thank both of you, Kaylin especially. She has really grabbed this process and made it happen. She's pushed it through, gotten everybody involved, she stayed on top of it. We've gave the health department marching orders to put together a plan for us. And it's the plan for this committee. This committee is going to take the plan and come to some conclusions as to what we want to do with our opioid monies and make that presentation or make that recommendation to the full board to start the process. And so this was the first step, but it was an important step. And what amazed me was how engaged and how active the community is in this area. We have a lot of people out there that are involved in the drug abuse and prevention areas. And they're very, very passionate. I mean, all of them do this, and they're boots on the ground people. They see families that are in trouble and individuals are in trouble. And, you know, that's what this is really all about, is our able to interact with that group and find the right methodologies and the right use our resources in a way that has the largest impact. So I was hoping we'd have something on timeline-wise that we'd be able to present to this committee, but MSU is, as Amy's indicated, really won't have their final results until September, and we need that block in to put together the entire operation here. Kaylin's strategic plan group, I mean, it was excellent. You know, the kind of people that were involved, they all know what they want, and they're going to be asking us for things. But I think having this overview is going to lead to having a better informed process for us with a better informed result. So I'm kind of, maybe I was a little skeptical in the beginning, but I'm really pleased with how it's turned out and how it's going. So I want to thank this group. I would like everyone to look through the strategic plan and talk to people in your community, talk to your contacts, because the next step is imminent, a little further out than what we had planned, but still, this year, we're going to have results and we're going to make recommendations. And probably will be the kind of recommendation that will be ongoing and have carry over for a decade. So this is some important work for all of us to do. And we have the resources here. We have people that really can answer any kind of question or put us in touch with who can answer the question. And I think we're kind of at that juncture where we have to be getting very focused on what we're planning on doing. So, and we have the right team here to help us out. So, thank you.
Is this report something that can be released to the public just the way it is?
We are hoping to. It's still in discussions on where it can be placed, but we just wanted to present today on the progress that we've made so far. But it is intended for community access and utilization, for sure.
Okay, well, I would suggest, because our commissioners have rented a space at the Eaton County Fair on the grandstand, if you could provide us with 50, 75 copies of this, we'd put that out with the other literature we're going to have out there.
Are we at that point? Okay, yeah, absolutely.
All right.
Yeah, this is just a draft, and it's hot off the presses, and you're the first ones to see it. And we've been asking for input on it. There's still opportunities for input, but I think we're pretty much ready to release it to the public. Am I correct there?
Yeah, I think the intention is for you all to see it today and then to move it to the full board. And then once the full board has the opportunity to see it and approve it, then it would be ready for public distribution, is from what I understand.
So the timing's a little bit off for that,
Yeah,
Brian.
because the fair starts a week from yesterday.
Right.
Oh, okay. It's earlier this year than it was last year.
I think it's next week.
Amy, did you have any thoughts on that as far as how that's going to work with the plan from MSU? I thought we had talked about releasing them both together.
I mean, that's really up to the county. If they want to go out together, I think there will be, that final report is going to paint a really great picture of what those needs are. But I think they can potentially be used separately. It would just be about framing.
You hate to miss an opportunity where you can present it to the public. You don't want to present any misleading information. You don't want to present something that isn't, that, you know, wouldn't be complete. On the other hand, I kind of think we're at the complete point to some degree, right? Am I thinking that if the public saw this, that we wouldn't be misleading them in any way, would we?
No, I think the only consideration would be around implementation or next steps and being able to answer those types of questions from folks that do so.
And that's the only issue. If we release it to someone and they look at our plan and they say, well, what are you gonna do with it? We don't have the answer to that yet. So that's the hard part too. And that's really where the rubber meets the road, isn't it? What are you planning on doing? And we're still trying to determine that. So, but we've got the background that we need to make the right choices, which is far more than we had 6 months or 8 months ago, where we just didn't, you know, a lot of counties just took this money and they gave it to their ambulance services. You know, they just gave it to whatever they thought was the right place. We took a different track and we decided that we're gonna do something that we're gonna study what was needed, and we're gonna interact and engage the community and figure it out. And so I think the way that we are going is probably the more transparent and the better way to reach the public and come up to some conclusions.
I think, given that information, I think it would be wise to put it out in the public, let them know we are doing something. We may not be complete, but we are doing something with this. So I think getting it out there, I mean, if we only contact 50 people, at least there's 50 more people that now know about it.
It's out there now because it's in the packet. So this is already out there. Yeah.
That doesn't require any type of movement from this board to just make it public knowledge. So yeah, I guess I don't see any need to move anything.
No.
Yeah, Jeannie?
I was just gonna ask, I've forgotten, doesn't this money continue to come for like 18 years?
Correct.
Okay, but I don't remember how much it is broken down per year that we're aware of, that we could fund different type choices?
Do you have the number, Amy, off the top of your head?
So
for-
the way that it works is that you will not receive the same dollar amount on an annual basis. You may not even receive funds annually. So this is the year where you will receive more money than the rest of the years, but for the duration of the 16 years, because we're about 2 years in, for the duration of that time, you'll receive small amounts. But those companies that are settling, they can choose the amount that they pay you, which can differ annually. And they can also skip payments. They just can't skip consecutive payments. And so it's really going to be up to the county to determine how much money can we spend, how long do we want to have these funds available. So some counties are creating an average annual amount where they feel comfortable spending while still maintaining a lot of funds in their account to be able to ensure that they have funds for the 16 years. Other counties are funding on the front end more capital projects and therefore potentially going to have less funds in the future, but are less concerned about time frame and more concerned about meeting immediate needs. There are a million different ways that this is happening, but most of those companies are paying with profits, and so it requires that they make those profits in order to pay.
Okay, so Amy, if we make a choice for this year, that doesn't mean that we'll have the same choice for year number, because we'll be on year 3 by the time we get money. So if we make a choice, okay, then year 4, we don't get that much money. That means we have to do different choices. So every year, we're going to have to do different choices, right?
So most counties are creating a process that will be the same annually. So they're taking that full amount that they're expecting to see, maybe dividing by 18, and using that as an average annual amount. So you have 3 years of payments from one company in the bank right now, 7 years of payments from another company right now. So the money is primarily front-loaded. And so you could say, we'll spend X number of dollars on an annual basis and then reassess in the future when kind of these first few years are over.
So we can drag it from one year to the next?
Yes.
So we can create like a separate bank account to
So
pull from?
It should already be in a, it is already in a separate account.
Okay,
Take it over, Connie.
it's in a separate account right now. The balance currently is just over 3 million that we have in it. But again, like Amy said, you wouldn't want to just dole out the 3 million unless that was the direction you wanted to do to build something, some program or something, but to dole it out over the course of the 18 years.
What would we say is our average amount annually?
I was trying to pull that up. I
120?
want to say, no, I think it's more than that. It's about 150 that we're getting from the distributor and Janssen. And then I think another close to 100,000 that we've been receiving, but I don't know the period of time. I'd have to pull up the schedule that we have.
Okay, so it's
now.
a significant amount.
It is. It
Just
is.
want to make sure we don't get into the situation like where we establish programs like that were done, because we've already had to deal with some of that CMH type situation that was done with COVID dollars, and then
Magically, the shelf-ready programs become, they just appear. Yeah, so like the idea would be to, again, that's my assumption, someone tell me if I'm wrong, is that why you guys are doing what you're doing.
right.
Create the plan for us, so we're not shooting darts at the wall. So
That's what
I
I'm
guess
saying.
that's what I'm waiting for the plan. So I guess that's,
'Cause I don't,
where I'm
I don't
at.
want them to have to come back to us and go, well, we need this, and we're going, well, you're not in the your regular budget, we can't do that.
I suspect
Right. That,
come September, we will have recommendations. And there'll be some choices that this committee can look at and make some resolution on.
sounds good. Any other follow-up questions? I think we have a general direction here. Yeah. Mhm.
We're not giving it to the ambulance.
Thank you very much. All right, very good. Miscellaneous.
no miscellaneous? Well,
The appointment list is in there.
oh, thank you, Claudine.
It's the very last page.
Yep. Last page of your packet.
Get to it.
I want to make on that, what we've got here, we're going to appointments.
Yep, I can get to it.
We don't have to do anything this meeting. These are just for us
Correct.
to look at. But I believe Tri-County Aging with Barbara, I think you're only allowed one term. Is that correct? Can someone clear me on that? I think for that particular position, we're only,
Doing one,
I will follow up on
I'll
that.
have to
we'll
find
look at
out.
that.
But I think they're term limited, which has always been sort of an issue. We get good people on there, and then it's like,
But Sue Hoffman's already
She's-
been there, so I don't think it's just one term.
no, I think
I'll find out.
we'll find out.
Yeah. The board rules say that you'll get a list of committee appointments every July. So that's why they're in the packet. We highlighted the ones that are expiring, just so you know, and then obviously we'll continue to discuss until we make the appointments later this year. But we're just following the board rules right now and putting it in the packet for you.
Very good. Thank you. Any other miscellaneous? Any further limited public comment? No.